So each child will age within 1 hour, and then you wait to go to bed.
Is that a birth? Is that an associated birth? Or like?
Basically, my presumption, what you're saying, Richard, is that if the child's alive and after they register them as a birth, and they register them as a birth, and if they die later, then they register them as a death, right? So it's a consequence of what's in front of them when they make that choice.
But if they're stillborn,
Then they don't register them at all. Register them as a death.
They're attached to the mother's record. I don't think that they get their own number. Well,
So-
do they get their own number?
Right, so is there a notion of a fetal death report?
Okay, we do have death audits for maternal health and newborn. So when the baby is born, I'm not really very comfortable with the people may be born and dies shortly after they go to death. I don't think they're going to back. In any case, if the birth is recorded, doesn't go any further. It's just known by the facility there or whatever the birth is taking place.
Does that registration then have enough information for both the birth and the death?
Correct.
It does. Okay, so it's one
Do
form.
you register, so if a baby is stillborn, it's not born alive, do you still register?
And then
Yeah, I thought, my understanding was that it was only, this is the paper way it happens right now, is that it's just recorded in the maternity register, come up with pregnancy with a stillbirth.
Yes.
That's all.
yeah, but it's right to register that will be it, of course.
So would you want that to be registered as a bioregistration?
Yeah, she's asking because there's some logic involved. If it's the same form that's filled out, they'll need to process the form to decide whether they're alive or not. Right? I think it's what
I'm not
you're
even
getting
familiar with it, from my experience in obstetrics and other systems, even that silver, OpenMRS can get that reading.
at. Right.
So
Being a stillborn and stillborn.
silver. I mean, it's born alive, that's a number, and then if that's even a minute or.
My guess is that there's a checkbox for stillbirth,
There is.
and that would be a different, they would process that message in a different way, that form in a different way based upon what was filled out.
Yeah,
in the form.
I don't even know, I'm asking, I think we even need civil registration form for a silver, I don't think so either,
No.
but just put that down as something we need to make sure of.
So you don't want to keep track of stillbirths then?
We can keep them as part of outcomes of delivery, but not as part of maternal registration.
Okay. So that form won't be filled out in that case.
Yeah, and they will not get it.
No, the form will be filled out.
They do not exist as a person.
Yeah, okay.
If they exist as a person at the time that they want to fill out that form, then they're registered as one. And if they die later, then that's a separate circumstance. Okay?
That's.
Does that sound right?
No, it is right, but one thing one thing that's interested me, as I think looking at the last, there's a fair number of silvers, and I've always thought that would be a very good thing to measure, as it often silvers are the result of insufficient attention of care or other things going with, that they were unable to go on, obstructed labor, et cetera. That would be an interesting outcome to measure. So if the baby is born alive, that means that we're not always going to have a for sure record of that baby, what happened. They die in an hour or 2 hours before they register registration.
Sorry.
They're not a stillbirth. They're a birth that has an open MRS number, or no? No, they're not.
Stillbirth is not.
They're not. A stillbirth is not, but a birth that dies a baby that dies in a few hours.
It depends on when they choose to develop the registration of it.
Yeah, so we won't always be able to follow your births, because some of them aren't going to be registered and exist. And even if they don't, okay.
What are you going to do?
No,
If,
that's fine.
let's say that there's
Yeah.
one birth attendant and she's delivering 3 kids simultaneously, and she doesn't get a chance to fill out the forms immediately after, because she's got to go from delivery to delivery. Five hours later, she decides, yes, the child is still alive, I'm going to fill this out, and that's a couple of hours later. That could happen,
Okay.
right?
You should be able to get that as a report, shouldn't you? And you still would get the death report, so you'd be able to,
Did you do a death report if the baby
I mean, you could still
was
pick
not
up
born?
the.
How can you get a death report on a person that never existed?
We're not talking about that, so I understand.
Yeah, you misunderstood what Chris was saying. Chris was saying If they're registered at 5 hours and die at 7 hours, then they were registered, they were live.
What if they die at 5 hours and then they have not yet been registered?
Then they never get registered.
And they would
I
never.
think it's such a thing like
Would that be recorded as a death?
there's a death after birth, there's a certain number of days where that's called postnatal death.
Yeah.
And that we recorded as postnatal death. That's not going to enter into vital registry.
Okay. So they're recorded as a death, but they're never registered as a person.
Yeah.
Yeah, there's
I'm
a,
talking about this as I think the practice will be surely because today the practice I think is in this paper environment. When somebody dies, that if chapter is a few hours after delivery, they will record, baby died after I don't know how many hours, and that's it. There will not be any vital registry of any sort. So I guess the electronic system should be the same way.
I think you're trying to draw a distinction between stillbirth and early death.
I'm trying to see your number of neonatal deaths out of the number of all births. Your N's going to be wrong. You should register them as birth.
That's right.
Yeah.
I think that's exactly right.
That's why I said if you run a report on that, you could get the number of kids that were born and died very soon. Because they would be
If you were registered all of them.
No, because they wouldn't be registered.
If they died before the registration event, and the consensus was that they need to fill out a registration event, a vital registration and a death event, then you need to be able to use the true denominator. What she's saying is that if it goes 5 hours before they have an opportunity to actually register them in the first place, and they're dead by that time, then we presume that they would never fill out a registration event in the first place, and so they wouldn't have a record inside OpenMRS at that point, right?
Yeah, that's what I'm thinking. That's what I just validated.
if you ran a report on people who died and were never born, you didn't get that if you could run it. And were never born. Then you'd know it was.
Yeah,
That's
you
the
could do
difference.
that. You're right, he's right. You
So
could do
then
that.
you'd get that coming.
Yeah, I think before a man is discharged, they'll have tried to report. So if whether it's 5 hours or even 12 hours later, when they know that they discharged, they say, okay, no delivery, this and that, but baby died after. So that report is typically big. In the mother's record.
You have to look at the mother's record to get the birth.
Yeah.
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 Okay, but
Yeah, I think the implications of
it
it.
seems odd to register a death that was never a person that might have
For me, it was more around that the birth certificate is really a legal document, and so it's really to the kind of, at least in our country, it's the lawyers who decide, when life begins, when basically people need to.
But the case is issued by local government anyway, it's not issued at the hospital. Right? So that definitely that child will not have protection to the civil registration office. So they will not have a birth certificate to show.
Yeah.
But if OpenMRS does register, fill out this form, will that trigger a data process where that generates a birth certificate for them?
The birth certificate issued. Okay, so we are now making it continuous by harmonizing, but it is the data that comes from the facility that will go and get validated by the local government. But it is a paper. As according to law today, this sort of electronic system will not trigger, will not be used as evidence for that matter. There will be registered in the book, there will be a form filled. In fact, I think there's also, you don't have to have witnesses.
So that's actually a problem with doing the electronic workflow because there won't be a printed document that the local government will go back and validate.
The assumption is this form, we can create this form of OpenMRS, and this form will be taken physically to the government. So that's what these are saying. So some of the information in this form will be pre-populated, both the mother's information.
So we're not filling out the form electronically, we're printing out a form.
Yeah. with the, that's what I-
Yes, we print it out. There is a space for signature of the hospital or the clinic, and that form will be physically taken to the civil registrar, and then that will trigger a birth certificate.
Okay. So that's a different workflow altogether than that we haven't done yet, which is to basically have OpenMRS generate forms pre-populated.
And that form is really a report. I mean,
Yeah.
there's terminology, right? That it's a big formatted report filled with this information about this child. And then I'll spot for signature on the bottom, and that's what they'll take to the owner.
And they'll have to enter in prior to printing it, the next ID on the list. To then, the ID generated from that ID group. So before we pre-print it, we'll have to enter in that temporary number, and that will be printed on the form as well.
So I just understood what you just said earlier was that if you could load in the ones that you were going to get, and you said that, I thought you meant electronically
Just,
Okay, since the local government forms, let's compare two sites where we have one now and nothing. Where we have no electronic system, this form will be filled manually, and the information that we filled sort of should be to the area, and it will be sent to the principal local government by phone at the sector level where we have a civil registry. Now, in an electronic environment, we shouldn't have information of OpenMRS and again at the same time fill it off in a form. But one thing is, this form already has a pre-generated number. Right. So what you can do is create the space for that number to be typed in, and you print it and sign it off. And of course, tear the other one and destroy the other that had that number because of the risk giving the same number.
yeah. Or instead of just generating a big stack of forms, just give them a sheet with the numbers on them, sequential numbers, and let them just tag it off the list. Save the paper. You follow what I'm saying? Because so you got,
okay, so you'll have to give
a list of numbers.
Correct.
That's it.
For those who have the electronic system like OpenMRS, that really.
And then in the future, just have a query an ID that hopefully exposes the service that says, give me the next available ID. I mean, in the future, you'd want electronically OpenMRS to get the next ID, right? Yeah. That's next year.
Yeah, sure. Where's Randy's bucket? He had his bucket up there.
I've been filling the bucket. Okay, so that's a brand new workflow, right? And there's an implication that OpenMRS needs to generate a printed form. Okay, that needs to be pre-populated from data in the database. That's a good chunk of development work.
So, not all the information
You know, what it can.
it has to be filled by hand.
Yeah, and so if that can't go live at the beginning, what we could do is just print or have a form and wait till they print and analyze those so we can go for the report.
It's not difficult, it's just going to take people's time.
Yeah.
Because you can make inferences from the data, there's logic behind that.
Or if you could have printed forms, so it'd be as convenient if we had.
See, look, everybody's face.
This week we never had
It's all is doable. I just think there's a lot in that. That's probably the most complicated thing I've heard yet. It's just rendering a piece of paper in a specified format, and there's something to it. I mean, if they do the summary, if you do the printed summary, then you've got a long way towards that. Yeah, just different kind.
That would stop us from going on, just have a paper form and fill it out manually until we get that report. I'm trying to report whatever it is working.
Right. Okay. And that doesn't generate anything electronically up, actually. That's not even create an MPI record. Or what?
Well, that's why I was asking whether I need to go register with the OpenMRS and an OpenMRS registration. I thought was one that was for client registry. And so you said.
Well, you print out this vital registration form, but if they're not entering all the information to make that, to describe that child inside that form, and you can't properly register the child. If you're just printing out a form based upon the information that's there, and then that gets completed and then sent to the, it's a matter of.
This is a question of the requirement that Mr. Health puts on this. You, Mr. Health could say, print out the form blank, fill it out. Or Mr. Health could say, before you can press print, you have to have these fields.
Complete these fields,
And then those fields go up to the finder.
Doesn't the baby have any cancer just like he would? I mean, have any cancer examined and checked out and yes. So there should be enough.
But that's the vital registration.
I see them as different things. I see an OpenMRS, so forget the vital registration layer on top of it. We were talking about that. Wouldn't OpenMRS still make them a person? What if you needed to give them medication and do a bunch of other stuff? What if they were in the hospital for a month?
This isn't a question of coulds.
It's all possible.
This is a question of what the decision on the work for. Because anything's possible. You could print out the form is fully populated as much as print out an empty form. You can register a patient with OpenMRS, you can not register. I mean, all of these are within the realm of possibility. The question is what is it that is wanted to be done?
What you're talking about now is kind of like a neonatal care system as well, that they're capturing encounter notes and things like that, which is way beyond, I think, what we talked about doing. Keep track of a child visit now.
Do we want to begin requiring the pediatricians and the neonatal people to begin entering data into OpenMRS as well? It feels a little bit like we're maybe.
I think the current which is on paper records is the information about the baby is put to the mother's medical record. The fact that the baby is born doesn't trigger a new medical record, They'll take the medical record, continue and say, okay, baby born, female, this weight, after score, and so on and so forth. So it will be kind of a continuation of the mother's record. Unless you want to say, okay, I mean, electronically it's easy.
Yeah, and every electronic system, I'm familiar with, splits once they're born.
They may not really realize they are creating a new medical record because they're going ahead by entering this information and then they get the baby's form. They are already indirectly creating or directly creating a new medical record for the baby, but they don't necessarily feel like they are creating a new medical record. If it was a paper format, they will still go ahead and fill.
I was trying to consolidate all those events into one by just simply filling out that form. And whatever you ask them to fill out electronically in that form, including the temporary ID, including maybe the APGAR scores and weight, and then that generates both the printing of the form, which goes, and also the registration of the child in the vital registry. I mean, you could send a message. You could do client registry too. I think it's just a matter of what you want that submission to print the form to actually trigger. And you'll need certain information to trigger certain things, so they'll have to enter more information electronically prior to printing that form to be able to do those other events.
So I think that's a urgent question, isn't it? We want
Right.
them to go to the client registry, as the registration of that baby goes to the client registry, as well as the civil registration form being printed and everything else, as well as getting registration of
I think that's what actually is going on. Because we'll have the fact that that baby is born becomes a client automatically. They'll even go out.
That's what I was mind.
They'll even go out with something that identifies them as a client, as an individual client, right? So of course, so that of course means they'll be registered in the client registry. And OpenMRS, this is not in the paper environment. It's not the case now. Environment you can have that newborn baby registered as a client in OpenMRS, and that doesn't demand so much.
And the client registry.
Of course, it's client registry.
Doesn't OpenMRS trigger or a registration of OpenMRS just the same as if I was a pregnant woman and triggers that message to go to the client registry?
You're in a different circumstance. You're not at the registration interface. You're looking at the mom's record and you're filling out a form for new delivery, which is a separate, it's not a registration event. You could link it to a registration event if you chose.
Yeah.
But right now it's just completing that form. When you submit that form, you can choose whatever behaviors you want after completing that form, including printing it out, including sending a message out to the shared health record, including sending a message to the interoperability layer to populate the MPI, all of those things. But you're in the office of the mom's record.
I was actually thinking they were going to do the registration, and you're right, it's much easier if you don't have to do that, you can just trigger it from the event that you're already entering.
Right. As a consequence
Yeah.
of
When
continuing.
you enter the maternity register, and when you get to the day you're entering about the baby, that birth also,
Yes.
that those pieces of information are treated as though they're a registration
Yes.
event, even though they're not in the registration.
And that's why you'll have to require certain parts of that form to be completed electronically in order to create a new record in the client registry.
So you'd automatically be linked to the mother.
Yes.
You have the mother's name and baby, assuming the mother's address should have that demographic.
Yes.
And all you're doing is entering the date of birth, the gender of the baby. You don't need to wait for making a registration.
Whatever is on that form.
So everything that we would need by virtue of backward registration.
And you can create an encounter, the first encounter for that child with those statistics, like the hours and things like that.
Yeah.
Those are all events that would happen when you say, I'm done submitting the form, and I want to print.
I just thought the environment where we have, OpenMRS, and we're registering the path. Yet we have these forms that have pre-printed numbers. Can we design the form, the printout form from OpenMRS to look exactly and fit exactly like
Yes.
the form, so that you don't have to enter that number. All you do is just remember to put the form, the actual form, and print. You get what I'm saying?
Oh, print over top of the template.
Yes.
But then you won't be getting the ID into the record system to put that information into the.
And if they put it backwards.
Well, you can still put it in. And you know what I'm trying to avoid here?
I know.
Is you print a form and you forget to get this form of the other number, so the chance you might issue the same number. Or you can even type in the number wrongly, because you're creating room for errors.
Are you putting a check digit in that number? A temporary
I
number?
think they will be.
Then that will prevent that from being a problem.
Mm.
The check digit is an internal validation, right?
But I don't think I could put any logic in that number before you know
So then there's not a check digit.
that there will be, because remember it's a number on the form, it has no information behind it, it's just a form. So that number will just be a special number. So in which case you can just print on top of the template, so you avoid. But of course, there could be room to type it in there. At least you can have the error or whatever it is. But at least the form will not have no error. So
They don't have MRS generated number in a range.
Of course, it has an ID generator, does that?
Besides its own computer, they
Yeah.
initially.
Whatever
As long as
seat
an
you want.
ID gives each health center their range, can they just not pull off that and have the system generated so that they do not have to?
Then you're creating multiple central authorities.
that's
That's
a
a
big
big
issue.
issue. Right.
It sounds like this is an important topic, that probably is going to
I did how to pre-register children following delivery, new auto registration event. So I think there's a whole separate, full conversation around what exactly happens during that. This is literally the first I've heard of this.
And deciding scope is going to be important.
Yeah. Yeah.
You're going to decide scope.
Just go see the look on my
We're very good at imagining and being very creative with all the possibilities. We need to be reined in by the reality of the needs of the actual users.
So there are a whole series of potential new triggering events that when you submit that form, you just link to that button, obviously, in that event, and you go do a bunch of other things. Ways like, right? It's all possible with, time and money.
Possible, feasible, what?
I think this is it. I mean, I guess that brings it to a close, doesn't it? It's amazing how you get all the way towards the end, you realize the further down you get, the less conceived it is.
I think it's even fuzzier right after this, the 6 week postpartum.
But that's not our story. The 6-month postpartum visit that are
2 weeks, and I thought it was an hospital.
Just to recap,
okay. So that's a.
Is that not in our scope? The 6-week postpartum, every doctor I wrote is in scope.
The first postpartum visit,
Yeah.
Oh, yeah,
it is in scope.
Okay.
Is that news to you, Wayne?
it's news.
She's not used 2 weeks. I said, the only form we don't exactly have is the postpartum one.
Just-
Way back then.
something I may have missed, or to nail down. When a woman goes into the hospital, have we worked out any way for the hospital to access the shared health center?
Yes, because it will be a separate instance of OpenMRS that will have all the same functionalities as the clinic, including the clinical summary.
Okay, so the hospital's going to have them in
That's what she said.
Anyways.
It'll be a like a clinic. I love you. Watch the screens.
That's right. Whether you want to push it or whether you want to.
Well, I'm in between because I'm not, they're trying to commit, I'm just trying to elucidate.
And then Richard says, oh, look at
The postpartum is, I think, I don't know if that's been conclusively determined as being in our scope, from what I'm hearing here. I know that the registration event is, but I don't know if the postpartum is. Because then you start going down the pathway of being a pediatric record system.
And that's why the specialist is so easy that just pick up the immunizations and she had them first.
Pretty soon, very easy.
I don't mean that we're going to do that, but I mean that this set them up perfectly.
Could you
for
nurse
instance.
certificates in here too?
Rather than register the baby.
It's so easy. Just get right into it.
Yeah, and one of the big things we did talk about earlier is the fact that it's not truly well done right now, 6-week follow-up, and that is also when you find out what the outcome of those neonates was. You had those 30 neonatal deaths, the bad events for the mothers, et cetera. So that was one of the reasons that I was in very early days of 2 years.
It's like surgery, online products, programs where you've got to do some type of surgery to really know what the consequences.
Does the postpartum visit happen in the ANC clinic or in the primary care clinic?
So it's not cheating well done right now. So they want it.
So you want to engineer that in the next couple months as
So
well?
often it's done when the baby comes for the first visit. So it's still done in preventive care clinics.
In ANC clinic?
Not ANC anymore, but yeah, in the same.
The same place where the moms see,
Yeah.
not in the acute care.
That's one question. I mean, there's quite a lot of things you can add, to all these different use cases. But we have to remember our timing and maybe to ease Wayne's worries. If there's certain things that we can't do, we can postpone those, but have something working. Even with the minimum, we've talked about so many things. So even if we do the few minimum, we'll still be good to go and start testing the realities and getting something going. So
It seems like the delivery event is in scope. It seems like the postpartum visit might be out of scope.
and that is actually okay. I mean, like Liz said, there are not very many postpartum visits anyway, apart from when they come from vaccination. So it doesn't matter as long as we have the delivery outcome and pregnancy
It is an
information.
opportunity to improve care. There aren't postpartum visits and
There are 1,000 opportunities to improve care, so you just have to grab one by one.
Okay, so we stop at the registration of the new.
It's not much care.
No, I'm looking at everyone to say that's the end of our scope. Because I've never been able to conclusively say where our scope begins and ends. And I'm trying to create that line right
Depends on the name of the question, but if it's something that really feels like, oh, there's something really Otherwise, I'm not the programmer, so I don't know what that actually means in terms of the time for programming.
Can we come up with with outcome measures, ideas of what we could measure to verify whether we were helping or not?
I don't think you necessarily need that postpartum result to do that. I think it would be helpful, definitely, but I don't think it's essential. Okay, so can we say that we've made it all the way through the clinical workflow now? I think we can. That's the first time I've heard all the way through.
Yes. And
Sounds a good time to know.
Are you comfortable?
yes, I learned something that I didn't know. So that's a helpful point.
What did you mean?
Well, I learned that we had a transaction to query for clients and bring them information. As, like, remember I was talking about 2 transactions? Well, it now appears to be we have 3. And I mean, and then, it's really different ways of shuffling the stuff we have and a little more network traffic. So that was, we need to talk about the maternal health data.
Yes, we can.
Just to clarify, yes, I'm okay with ending at maternal or ending at the birth. Can we actually make it the end at when the mother goes home from that clinic or hospital? Because if, for example, she was admitted that she delivered by cesarean section in the hospital and then dies 2 days later from a postpartum hemorrhage, we would still want to, I think it would be reasonable for us to collect the information up until the discharge from her delivery event.
I don't know the way in which they practice. I think in terms of forms at this point, in their forms for the registration, if there's a separate form for every day's visit, and that's a question of, is that in the scope still?
So
How do they capture
in the
information about
hospital,
deliveries?
The form we talked about in the hospital just had the date she went home and her discharge, disposition, alive, dead, whatever, and any complication of diagnosis. That was one from the hospital.
So again, this feels like a question of, as a researcher, as an epidemiologist, getting that information I think is very important. But is that within scope? This is another of those questions where should we be doing it? And I don't know how to answer those questions. Frankly, without that.
Could you just speak to that?
So rather than our scope end at the moment of birth or whenever birth is registered, I wanted it to end when the mother goes home or dies after the delivery event. Meaning, she delivers in the hospital, has a cesarean section, for example, and if we ended at birth, then she dies 2 days later in hospital. She hasn't gone home. She died from sepsis, whatever. We would not capture that if we ended at birth. If she dies in the clinic, 24 hours after she delivers, she's still not gone home yet.
It's critically important information, it seems to me, but I guess what I don't understand is how the clinic behaves. Are they documenting every day or every few hours?
There is.
It's possible, and I'm sure it should be, if that's in our current climate, there will be documents.
We had one just for the hospital, discharged from the hospital, but not necessarily from the
There are the question is, do we collect antenatal maternal death? That's the question. That should be postpartum. Sorry, postpartum maternal death. Is that an outcome of interest? Yes.
I think it is.
Yes.
Okay, this is what I think we should do, and I tell me obviously it is, because we're choosing technologies now. But we should have the outcome of the delivery until the mother is discharged and gone home. Basically, like the visit, when you close the visit, everything within that visit. Okay, it could be the mother actually died, so it's going back date. Or the liver and the baby died But you see within the clinic, maybe 24 hours later, again, that shows to be captured. But basically, by the end of the visit, which is the visit trauma delivery. Is that complicated? Right?
She's not informed, probably.
We need to have a form. So what they
It's like a discharge summary.
Yeah, exactly.
Yeah. That's what we're talking about.
And we always talk about doing that at the hospital, but
For
again, only those few elements. If the woman is quite critically ill when she delivers in a health center, they don't feel that if she dies as a result of that delivery, like 6 or 7 hours, like it's a crisis kind of thing, they'll report that in there as a maternal death, and they, blood loss and all the complications associated with that, they need to be registered. What I'm not sure about is if she dies 24 hours later, was well, goes and is recovering in the room right next door, and then died.
I think we're still facing the register.
I think that they still probably do.
Yeah. So we're not out of scope, we're still within the maternal register.
But they write maternal. They write the maternal register.
Right.
Whatever. No, but they would go in and change it, cross that out, whatever, right? So because we're going to collect data in a different way electronically, we want them to enter it at birth. I mean, you can let them wait, but then they have to write it on paper.
You just need to help us understand what the
Yeah, I have to find out. Maternal deaths are very rare anyway, so I'm not really sure what
But
happens.
they're like a major key thing that the country's following.
Yeah. But, yeah, I'll have to find out.
Again, but, so we're asking a scope question, and they're gathering it today. The question is, I think to Richard, or maybe somebody else, is do we want to start gathering that electronically, starting with this use case, starting with this process?
Actually, you don't even have an answer to whether it is entered on a maternal register. Today, basically, from paper, do they do that?
What's the cutoff point for it being put in the register?
Yeah. And then fill in the register right after birth, and if the mother dies, let's say the next day, then they'll keep the register as is and won't put that information. I don't think so.
I think they changed in the register.
Well, they probably feel that at this church, don't they?
Well, they do it, because a lot of times I was looking in the register, women are still physically here and they're birthed in there. But they do them in sequence, right? So if somebody stays longer, they do it sometimes shortly after birth, not minutes, in between them.
Mm-hmm.
And so it's not necessarily in there. I think they might go and change it.
Let me ask on the form, is there a space or room where they write that the reports are
On
the form, the maternal registry form?
so it's not a point, it's just the register.
Okay, the register.
And there is a spot for maternal left, yes.
Yeah, I think they'll still write it.
Yeah, I think that'd be
Yeah.
right. Because almost always the health centers are trying to transfer.
Yeah.
And it's rare for someone to actually die in a health center. And if they did, they wouldn't maybe fill it out because it's touchy. And maybe the busy written in the register when they have it critically ill.
So I think the answer is, Sharon, is we include that.
Okay, so let's go.
Okay, so it says their discharge disposition, they were at home, died, transfer.